health body, the World Health Organization, estimates that more than 70 million people have been infected with the HIV virus. That's people who are living with the virus and know their status. 7.5 million more people who are yet to know their status need to get access to testing services to ensure that the percentage of those who know their status increase to 90%. At the end of 2016, the 6.7 million were living with HIV globally, and about 1.8 million new infections were recorded. HIV has claimed more than 35 million lives since it started and is considered to be a major global health problem. Antiretroviral therapy coverage for pregnant women and breastfeeding women is high globally. These and many more startling revelations about HIV will form the basis of our discussion on the program Healthy Living. I am Diana Odra. Welcome. With me today on the show is Dr. Ugochukwu Lewechi, a medical practitioner. Welcome to the show, Dr. Ugochukwu. Yeah, this figure from 2016 is alarming. 1.8 million infection. Can you tell us what age group, what type of people make up this group?
Okay, the figure is alarming. Yeah, that's true. But we should get the perspective that HIV is actually a global thing, not a Nigerian thing. So the figure might be alarming, but it doesn't represent what it is in Nigeria. So about the age group and the percentage, we know that most times you see people aged between age 15 to 49 are actually most of the age group that are captured in this study. Though children can also be infected through mothers who are infected with HIV and pass it along to the children. But mostly, what we usually see is people aged between 15 to 49 are actually the most affected here.
Okay. Do they have any particular lifestyle, or it could just be anybody?
It could be anybody. That's the truth. It could be anybody. You see that 80% of the new infections are coming from unprotected sexual intercourse. So it could actually be anybody. But within this, the last study done by the USAID, as in 2016, you see that the prevalence is actually more in this population when you want to look at the sex workers, men who sleep with men, and also intravenous drug users. These are three categories of people actually have a greater prevalence compared to the general population of people who are prone to having HIV.
Okay. Are you saying these people are responsible for the spread of HIV?
Responsible for the spread?
Mm-hmm.
Okay. No, I wouldn't say they are responsible for the spread of HIV. Some of our practices, what I would say are responsible for the spread of HIV. Now we are, just like I said earlier, at 80% is, in this last study was seen to be from unprotected sexual intercourse. So unprotected sexual intercourse ranks topmost there. But the other practices like intravenous drug users, sex workers, and men who sleep with men, these practices also help in propagating the spread of HIV in Nigeria.
Okay, let's come back to Nigeria now. This was a global statistics from the WHO. So in Nigeria now, what is the statistics presently of people who are infected?
It is estimated that about 3.4 million Nigerians are living with this disease. That's according to USAID. About 3.4 million Nigerians are living with this disease. Last year, study done by NACA last year, that's the National Committee for Control of AIDS. Study done last year shows that the prevalence is actually dropping around 220,000 new infections that happened last year. This is against that previous ones in 2010. There's a significant decrease. Well, because of the sheer population that we have in Nigeria, over 180 million people, and that's been having a conservative estimation. you still see that the burden of HIV is in Nigeria is highest in sub-Saharan Africa because of the population we have.
Okay. What are medical services doing to assess treatment?
Okay, to assess treatment, of course you need to be diagnosed first. You need to be diagnosed first. Almost all health centers and primary health care facilities in Nigeria have a place where you can actually do your voluntary testing and counseling for HIV, sponsored by different NGOs and the world and the federal government of Nigeria. So getting access to being tested is actually not a problem because you see that it's almost to the doorstep in the communities. Primary healthcare centers all do the rapid testing. So the government have done a lot. For people to know their status, they have to be this public health enlightenment. That's actually where the most important thing, because these services are around people and yet they don't know about it. So except they are enlightened, except they are told about it, they don't usually come. So you see people holding outreaches, medical outreach, and to do voluntary counseling and testing. So a lot has been done in that area.
I am aware that you were a volunteer for HIV, one of the NGOs were there about. Now, I want to ask, in most rural settings in Nigeria where it's very difficult to communicate with the people, and most people don't believe in HIV, most people don't believe HIV exists. So how do you get to convince these people that there's something really called HIV?
Okay, a lot has been done on that ground about public enlightenment. We've had a lot of radio jingles, a lot of community enlightenment programs, a lot of hospital-based enlightenment programs as well. So a lot has been done when you want to talk about public enlightenment about HIV. Yes, you still have places where some traditional practices still don't accept, or would rather not accept, that there's an entity called HIV. But that having been said, a lot of people actually come around. A lot of people come out to access services.
Okay. What's the availability of drugs in hospitals? I'm particular about the rural settings because in Abuja, I think walking to the National Hospital or any hospital that provides these drugs is easy. How about people that probably they even forget to take their dosages? What's the availability of these drugs in rural settings?
It's also good to actually bring to light that most of the people who are infected with HIV also live in rural places, so it becomes even more difficult. You come to see that most times the drugs are available only in the urban centers. So the people in the rural areas move out from their different areas, come into the urban areas to access medical care, and that has been a strong inhibition. Now, the availability of drugs, less than 50% of people living with HIV are under the HAT program, that's the highly active antiretroviral therapy for people living with HIV. Less than 50%, and that's the 2017 study. You see that it leaves over 50% more not being on drugs. So about availability is still something that is ongoing. The availability we can't say we have done well when we want to talk about availability of HAT in the local communities and villages. There's a lot of deficiency in that. So most people in the villages still don't have access to the highly active antiretroviral therapy.
What's the government doing about this?
The federal government has partnered with a lot of NGOs. I'm sure you know the Bills and Melinda Gates Foundation and some other non-governmental organizations like the FHI 360, the Institute of Human Biology, and so many other, the Global Fund for HIV and AIDS, which I think rounded up their program in Nigeria last year. So there have been a lot of partnerships that have gone on to make these drugs more available. But just like I said, the sheer population of Nigeria and the number of people who are actually living with this disease makes it a bit more cumbersome. But the statistics have been increasing. For the last study, it was like 30%. Now it's getting up to 50%. That means progress is being made.
Okay, now, are these drugs free? If I move to my next question.
Yes, highly active antiretroviral therapy in Nigeria is free. It's free it's meant to be free in every place that can give the services.
Okay.
It's supposed to be free.
Okay. Now, there's this magic that happens when when it's spouse, they go for two couple, they go for tests. One is positive and one is negative. What's that magic?
Okay, we call that serodiscordant couples. That's what we call that. So it's not a magic.
Yeah, because
but we've come to see that happen several times in the hospitals where a man and a wife comes in and one of them is positive, you test the other, and the person is still negative. So some studies would show that some people also actually don't have the receptors in their cell to actually that can hold on to the HIV virus when it enters their body system. So because they don't have these receptors, it can before you can have an infection, the virus has to be attached to your cell. Then your cell will take it in. So when you don't have a receptor that can hold on to the virus, then it's almost impossible for you to be infected. Then you also see cases where maybe they look at the viral load. One of the things you look at when you want to talk about the transmission of HIV is viral load. So when people who have reduced viral load, and that's what the ART, the highly active antiretroviral therapy does for you, it drops the viral load. By dropping the viral load, it reduces the risk of transmission. So most times you see that the lady might have known her status and has been on highly active antiretroviral therapy. Then they'll be meeting the husband or meeting the wife, or they're meeting the wife, as the case may be. And because of the reduced viral load, transmission is brought down to barest minimum.
Okay. How can stigma be handled? Most people have died because they don't want to be stigmatized. See him going or see her going there. She's a carrier, or he's a carrier. Most people have died in silence because of stigma. How can stigma be handled?
Yes, in where we live, that's the sub-Saharan Africa, stigmatization is a big issue. Why? Because of our way of life. We've not even opened up when we want to talk about our laws, we've not even opened up our laws. So you see there's a maximum of 12 years for people for the homosexuals. And this prevalence, we've seen that the incidence is more in homosexuals, drug users, and all that. Nowadays, sex workers also have law. They get up to 2 years when they are caught. So because of that, you see them, they don't usually come out because they are afraid of litigations. So they don't usually come out to actually face they don't usually come out to actually say, okay, I'm HIV positive and what can I do, what could be done? Why? Because of this, the not just the stigma, but also the legal aspect to it. Now about stigma is mostly cultural. It's mostly cultural. You come in, you say you're infected with HIV, people see you as they don't want to share spoon with you, they don't want to share plates, they don't want to stay in the same room with you. So, and we keep telling people you don't get HIV from sharing spoons or eating together or sleeping together on the same bed with people or in the same room. So it's actually more like a cultural thing. So it's the stigma is quite a big problem. But through public enlightenment, we get to see that people are being accepted more now in their societies than before. If you want to check when the first diagnosis was made in around 1986 in Nigeria, HIV was like a death sentence. Everybody runs away from anybody that is confirmed to be HIV positive. But now, families have members of their family who are infected and they begin to understand these things even more better.
Okay. Can nutrition deficiency make it worse?
Sure. HIV is human immunodeficiency virus. At the end of it, you have AIDS, which is acquired immune deficiency virus. So it's really not a disease per se that attacks any specific organ in the body. It's just brings down the immunity to the extent that we can't actually fight infection. So any other thing can come in from any other place, and so malnutrition, of course, is one of the things that reduces immunity. So nutrition is very important for people living with HIV. If you eat well, you're most likely going to live a better life than someone who is malnourished. If you see someone who's living with HIV and is well fed, is not likely going to present with some of the symptoms early, and not likely going to present with some of the later symptoms of HIV in life. So nutrition plays a wonderful role when it comes to HIV and AIDS.
Okay. Do they have any particular food they have to eat?
No.
They can eat everything.
They can eat everything and everything.
Okay. We'll go on a short break. When we come back, we'll throw more lights on HIV. Please stay tuned. Welcome back. So far, we've been talking about HIV, and still with me is Dr. Ogochukwu. How fast is the diagnosis made, and how accurate is it?
How fast is diagnosis made? Diagnosis is quite fast because we use the rapid test reagents. What it means is that the rapid test reagents are actually highly specific, but highly sensitive, but not specific. What that means is that when you test a serum, it's actually an antibody test. When you test a serum of somebody who's positive for HIV, the possibility of it giving you a negative result is almost zero. So the rapid test is actually very sensitive, but non-specific. The diagnosis is fast. You can get tested within 15 minutes. So all you need to do is to get a prick, put up your serum on the strip, and put up the reagents, and within a space of 15 minutes you get the test. So if someone tests positive, there's a way to it's not actually a confirmatory test, but the confirmatory tests are actually not antibody tests; they are antigen tests. So to be more correct, you can do with other reagents. We have the Unigold, the Determine, and the Star Pack. The Star Pack and the Determine and Unigold are actually called the tiebreakers. So just in case someone is positive and you want to be sure that the result you're getting is correct, you can use the other ones as well they're called the tiebreakers.
Okay, are there kits people can test with individually? Maybe just sit at home and you don't want to go to the doctor, or you don't want to go to one of the people that do this test, and can you do it by yourself?
Yes. The rapid test you can do it on your own as a patient in the comfort of your own home. All you need to do is to just buy the kit and test yourself at home. By reading the leaflet alone, you already know how to use it, when you're positive or when you're negative, because it's actually very simple. It's a very simple test. You have the control and you have the test. So all you need to do is when you drop the blood sample or the serum and put up the reagents on it, you look at it, you leave it there for like 15 minutes, then look at it. There are 2 bars there. You have 2 bars. It means the serum is positive for HIV. If it's only 1 bar, it means it's negative for HIV.
Okay.
So it's that simple. It's actually that
just
simple.
like a pregnancy test strip.
Exactly.
Oh, okay.
Just like the pregnancy. I'm sure everybody knows how to do that. Put on urine there and all that, and it's all done. It's that simple. But there are other confirmatory tests for HIV, where you have to do the antigen test. So you can do the polymerase chain reaction, as DNA PCR, or the ELISA. Those ones are more like confirmatory tests. If someone have tested positive with an antibody test, you can actually now go for the confirmatory test to do the antigen test.
Okay, thank you. With the current figure from NACA, you said, or UNH, I think so far there have been an improvement with the handling of HIV, and we don't get to hear it as much as we do in the past. So, are there special bodies, or are there special people that train to be able to talk to people or counsel them when they test positive?
Yes, if you look at it very well, you see that it's called voluntary counseling and testing. So it has to be counseled first before the testing could be done. So a lot of non-governmental organizations, a lot of governmental organizations are coming to the fight against HIV/AIDS and public enlightenment about it. So there are a lot of people being trained every day. Like there's an ongoing program by an organization called NICE. They are running one of the a very massive survey on HIV/AIDS in Nigeria. I think it's ongoing now. So there are a lot of organizations come in for this, and they've been doing a good job.
Thank you for coming on the show, Dr. Ogochukwu. It's been a great pleasure having you around.
Thank you very much. Thank you for having me.
Thank you for staying with us on today's episode of Healthy Living. I am Diana Odra. Keep watching Television Nigeria.